Dr. William Samoei Ruto, Party Leader ANC, Honorable Musalia Mudavadi, Party Leader Fort Kenya, Honorable Papa Waroma, due protocol observed. Good afternoon. Indeed, I hope the Speaker who has just left will be one of those who will be nominated to Parliament. Your Excellency, I have been following these proceedings as I come on my way, and I've had some of the questions, the issues you have been raised. And one of the issues that has been raised is what has county government been able to do that is good and that should be maintained. It's very good when we critique a system, we look from the both sides of what that system has given us. I will begin by saying the good things about devolution. Devolution is good. It's not bad. We must agree. For example, the areas where devolution has improved in the health sector is the issue of increase in healthcare facilities. We have seen tremendous increase in healthcare facilities after devolution. Of course, that is the area where many politicians, especially the governors, will want to see structures. And they'll want to see the electorate that, look here, we have a facility here, we have constructed this, we have constructed this, but that facility is not enough. There is what goes into that facility to make it a functional healthcare facility. Another area that the county governments have tried is to increase the number of basic healthcare workers. I will admit that at the national government, the last hiring that took place before devolution was 300 nurses across the country. Machakos County government alone hired 800 nurses in 2017. And that must be recognized. Another area that the county governments have done very well is to increase the number of equipment through the management medical equipment scheme. We have many equipment, many hospitals, at least 2 hospitals in every county have those equipment. Also, again, the problem comes with the human resource, which I'll come to it later on. Now, as a healthcare leader, as a trade unionist, what are the challenges that have come along with the devolution that we think need to be resolved? Because every time we mention about the Health Service Commission, all the governors will come gun blazing. I will not be mentioning the word Health Service Commission, but I'll be mentioning the areas that I think should be addressed. And if in the process of trying to address this issue, the solution will be the healthcare system, so be it. One of the areas, Your Excellency, when I came to my office this morning, I got a brief from my employees, and I was told that there was a strike in Embu that ended over the weekend. And I wanted to know what it was for, because I was not even aware as the General Secretary. And they told me all health workers, doctors, nurses, clinical officers, physicians, everybody had gone on strike because Embu County government has not been remitting statutory deduction for the last, 1 year or so. It means those health workers cannot even access healthcare services because the NHIF deductions have not been remitted. And the strike ended over the weekend after the courts gave the orders. So what are we saying? We are saying that health workers have gone on strike so many times, not because they want salaries to be increased, but because salaries have not been paid. We have some counties where salaries have been paid and others have not. So many of the 85% of the industrial action in this country have been occasioned by non-payment of salary in most of the counties. Non-remittance of statutory deductions. There is also the case of discrimination occasioned by tribalism, nepotism and clanism that has already been explained, I think, by Dr. Thuranira. I saw it online when I was coming. Funding of healthcare remains a major challenge. For example, the Constitution requires that every health facility in Kenya must offer emergency health care to every Kenyan or every person who goes to that facility, for example, after a road accident. But the question is, Who funds this emergency health care? You come to my health facility, I'm a private practitioner like Dr. Timothy Olwey, and you have an accident and you go there. He's supposed to give you emergency health care until you stabilize. Who is going to pay for this? We must have a system where a fund is developed, regulations and policies are put in place so that emergency health care is funded. We also have a challenge. When the primary health care was destroyed, and it has now been replaced by community health volunteers who are now taking care of the functions that were taken off by public health officers. You know, when I was a small boy, my mother in the shop there would say, "Mtu wa porafia anakuja na tutafunga mlango." The shop must be closed so that mtu wa porafia asishike mama. I didn't know that the porafia person was to make sure that we have a toilet, our place of work is clean. So that responsibility has now been taken over by the community health volunteers, who we recommend strongly that they should now be turned into community health workers and be paid something for doing that noble work. We have heard explanation on how healthcare is suffering in terms of specialized training. County governments are employing basic healthcare workers. Those, if you are a nurse, you have a first diploma or a degree. If you are a doctor, they're employing with a degree. But when it comes to specialized healthcare workers, is where you have a challenge. That has already been explained, and I need not to repeat it. We have also had the issue of lack of medicine, has probably been explained. Unequal promotions. I'll give you examples of two counties that have done very well. When you go to Kiambu, our union has spearheaded at least 4 promotions from the day devolution took place. But in other counties, we have 0 promotions. So we have health workers in Kenya who are enjoying, like in Kiambu, and we have other health workers elsewhere where promotions has not taken place. Because these are the issues that lead to disruption in healthcare services. So how are we supposed to address these issues? I've heard somebody say that centralized system is not good for the country because it has failed before. Why do we have the Teachers Service Commission having teachers working everywhere in the country? Why? Why do we have national schools in Mandera? Why do we have national schools in Wajir? Let us not try to paint health workers as if they do not want to be managed. We do not want to manage ourselves. We must have to resolve the issue of strikes related to non-payment of salaries and non-remittance of statutory deductions. Let us have a centralized system of payment of salaries to all health workers and indeed all public servants. Because it's not only health workers who are suffering at the county governments, it is all public servants at the county governments who are being reduced to beggars. Today, we had the central bank said that it has billions of shillings that have not been taken by public servants through mortgage and car loans. Why? Because county government employees are not classified as public servants. So they cannot access mortgage and car loans, which is only 3%. So after devolution, these health workers, you see, are now just getting expensive loans like any other millionaire outside there, making their lives very, very difficult. So for me as a healthcare worker, if you give me a centralized system of payment of salary, a centralized system of allowing county governments to give us the specs on the employees they want, you, County A, give us the specs as the health system, as the whatever it is, the workers you want, pay, employ them. Once you employ these workers, offload them into that system. Even if you have the Health Service Commission, as we have been saying before, of which, if we can get our salaries on time, statutory deductions can be paid on time, and there's a system where health workers can work across the country seamlessly. For example, Wajir County wants to have a neurosurgeon. It will simply release that specs to the hiring authority and say, we want a surgeon in Wajir. And whoever is responsible for hiring, I told you I'll avoid the issue of Health Service Commission. Whoever is hiring will post that surgeon to Wajir. Whether the surgeon being posted there has been hired today, or one is being removed from Kakamega and being taken to Wajir, and the one being hired is being taken to Kakamega, what is important is we must have a surgeon in Wajir. That is one of the suggestions I'm trying to say. But the issue of salary, salary deductions, discipline is another area you have said that we want to manage ourselves. How are teachers managing themselves in terms of discipline? We will give these powers to the county governments to be able to identify and give some disciplinary measures, because we know the issue of tribalism, nepotism, and corruption at the county government level. We want to remove healthcare system from the political system to a professional system. But there must be some level of where there is regulation. We are not trying to say that health workers must work when they want. You cannot work when you want. You must be on duty when you have to be on duty. But if you are not working, the county government can be given powers to stop your salary, remove you from employment, and wait the body responsible for a disciplinary process to take its course. And if you have to be dismissed, you can be dismissed. So we should not use scapegoats of saying that health workers want to control themselves, they don't want to be managed, to deny Kenyans healthcare services. We have gone on strikes for so many times, and Kenyans have not benefited from devolutions because of the services the health workers are supposed to get are not getting. Imagine today in Kiambu, in Embu, health workers in Embu cannot access healthcare services they are giving to the citizens. When you go on strike, they will rush to court, get orders, will go back to work. Nowadays we are respecting court orders, because if you don't respect the courts, then the country will be in chaos. I think that's all I can say. If what will solve these issues will be the Health Service Commission, so be it. Thank you.
Iwapo unapenda habari ninazokuletea, basi subscribe kwenye channel hii ili uwe unapata uhondo kila wakati. Shukran.
Mzuri sana mheshimiwa.
Thank you for your presentation, Seth. We want to look for solutions. And as an incoming, we want not to have, we have so much tension and downing of tools by such a critical sector. You are non-committal on the Health Service Commission. Now, can you help us to understand under what arrangement can we have a neurosurgeon within the context of devolution moved from Homa Bay to Kiambu, or from Mandera to Nakuru, and vice versa? How do we engage legally the devolved units to surrender their staff who are on their payroll to other counties? Number two, I don't know if nurses also take the Hippocratic oath, but doctors do. You know, when teachers go on strike, the children and students can be taught another day. But when healthcare providers go on strike, people seeking emergency services cannot wait for another day. How do you reconcile your Hippocratic oath with now the trade union activism that we see of doctors downing tools, people coming for emergency, they can be treated, they end up in private facilities, they can't afford, and so on. Number three, what would be your thinking? You know, we have had this in the Senate, that perhaps if we do not want to change the constitution because the mood in the country has not been in that favor, we try and persuade the national government to open referral facilities in the regions. They can cluster regions, and where possible, with big counties, they can give them those facilities so that they can continue having those professionals and serve wananchi in the manner that we expect. But short of that, perhaps a center that can be able to have a bird's eye view over the health system in the country to move personnel is an idea that is not too bad, as long as we balance it with devolution, because the people of Kenya voted for this constitution because of devolution.
Iwapo unapenda habari ninazokuletea, basi subscribe kwenye channel hii ili uwe unapata uhondo kila wakati. Shukran.
Thank you very much, Honorable Moses Wetangula. The first issue about how we can transfer health workers from one county to another county. I did not say I'm not supporting healthcare system, the Health Service Commission. I said I'll remain uncommittal because my brother who spoke earlier had already spoken about it. And when the governors hear the issue of the Health Service Commission, they just imagine that we want to go back to the national government. They don't know that the Health Service Commission is independent of the national government and is supposed to be independent of the county government in the form of being controlled politically. I have said a conversation must be opened. And I've said the issue that I've raised, for example, on transfer of health workers or redeployment of health workers from one point of service delivery to another point of service delivery. And I've said, if this conversation will end up saying that the only solution is the Health Service Commission, I said, so be it. So I did not say Health Service Commission should not be there. Why do we have a Health Service Commission for teachers? And yet we have national schools in every sector, in every county of in this country. So that one can be done. I can't give you an answer. I've said, let us open a conversation. And if the only solution will be the Health Service Commission, then let us revisit our constitution. Our constitution is not cast on stone. It can be amended. The issue of number 2.
Iwapo unapenda habari ninazokuletea, basi subscribe kwenye channel hii ili uwe unapata uhondo kila wakati. Shukran.
If nurses take hypocrite oath, no, we take the Florence Nightingale oath. And that is, the nurses are the only profession in the world that have a convention, which is a convention number 149. And along that, we have a regulation that governs industrial actions. And the convention requires that when we go on strike, we ensure the welfare of the nation in terms of health is not compromised. How do we do that? We must have a collective bargaining agreement that tells when you go on strike, these employees will not stop working. For example, you can't go stopping ICU machines from patients saying that I'm going on strike. Those are issues that we require to have a broader way of discussion. The last question was about Mheshimiwa. I'm just trying to tell you that we don't remove nurses from ICU. For example, we don't go tell mothers in labor that leave. We go and we take care of the patients who are there. We don't leave them to die. That is what the ILO convention requires of us as a profession.
Excellent. The last was whether an expansion of the referral services system in the country would help address your issues. And in addition to that, even counties are covered under the Constitutional Commission, the SRC, the Salaries and Remuneration Commission. Has your union ever engaged them to see whether the provision of mortgages and car loans and all those issues you are complaining about can be extended to services being provided in the counties? Because I see MCS in the counties have access to mortgages, have access to car loans, courtesy